Hello, everybody. My name again is JDavis. Welcome back to Radio Entrepreneurs. Uh, I don't think it's an understatement to say that I've spent my whole business career talking with entrepreneurs, trying to help entrepreneurs to understand what does it mean to be successful. And that's part of the reason we do this show, and that's why we have the sponsors to this show. We really want entrepreneurs to understand there are many ways to success, and it's easier to find failure than success. And so we'll continue to interview people. Our next guest, first timer, hopefully she'll be back more than once, Joanna Shu, co-founder and CEO of FreezeNit. Boy, I got the chills just saying, what is a FreezeNit?
FreezeNit, yeah, we're developing a medical device for the treatment of head lice that uses only cold CO2 gas.
For
So
the
it's a little
treatment of what? I missed that.
head lice,
Like,
the bugs. Yeah,
yikes.
I know. It's makes me really unpopular, but
How does someone choose to do that? I know if I'm sitting in my backyard, which you can actually see over here, we get a lot of no-see-ums, and I'm always like picking them
mhm.
out. So, how did you get into what drives the person into that business?
In the head lice game, yeah, no, it's not. I don't think it's anybody's first choice. My first kind of startup was skincare, so it was a natural skincare company. It was much more party friendly. You know, people like to hear about it now. Maybe not as much, but they're interested. So I exited from my previous company, the skincare company, Refresh Skin Therapy, and yeah, last year. And I was looking for a new challenge because I'd been doing that for about 10 years, and I felt like I was getting stale. And I was looking, I wanted a normal job. You know, I didn't want to be in charge anymore. I wanted someone else to tell me what to do, just click a button and go home at the end of the day and sleep at night. And of course, that did not happen. I met my co-founder, Dr. Carol Spangler-Vaughn, and she's been in the life science research field for decades, and she was working on a project for cold capping. So that's when chemo patients, they cool their scalps to keep their hair during treatment. So she was looking at different ways of doing that, and she made a design that was too short acting for chemo patients that uses cold CO2 gas because chemo patients need to cool their scalp for hours, like 6 to 8 hours. And this was more like minutes, 30 minutes-ish, but she had an idea, like maybe it could be used for something else. She looked into it. Turns out it can be used to kill head lice. And as it's not related to her main company, which is chemotherapy, side effect mitigation, she spun it out into a new company and she brought me on. She was looking for somebody with more consumer product experience to bring it to market since although it's a medical device, we definitely have to talk to mom. And I'm very familiar with talking to mom and making the case that this is a better for you option. So here I am.
So you say, Mom, is this a B to C product, business to consumer, or it's not
It's
going to a medical company, is
It
it?
is. It's actually going to be, well, the ideal is it will be found in your pediatrician's office, at your dermatologist, maybe at a walk-in clinic, urgent cares, because when lice hits your household, you want it done and gone yesterday. So
Yeah.
your people are less willing to wait around for something to be delivered in 2 to 4 business days. They want to go somewhere. They want to trust that it's going to be done right by a professional. So, and quickly and safely.
That's interesting. And have you been selling the product yet, or what stage of development are you at?
Yeah, not yet. We have a proof of concept device that we developed at University of Texas in Dallas. We are working on version 2 right now so that we needed to add some more safety features so it could be used in a clinical setting because ultimately we want to run clinical trials to prove that this works. So we have 2 clinics who've signed letters of intent willing to test our device once it's ready. And I'm hoping that this fall/fourth quarter, we can begin those clinical trials.
So are you going to need FDA approval for the product?
FDA clearance, yep, but it will likely be a class 1 device. So just to put that into perspective, Band-Aids and tongue depressors are also class 1 medical devices. So it's not nothing, it's not a skin cream on the shelf, but it's a fairly reasonable regulatory bar.
Now you talk to us a little bit about your cosmetic background, and you clearly have better skin than me since you're 30 years older than I am. And
You
can you,
sound 30
I'm
years
just
older than me.
joking.
Yeah, I'm
I'm just
80.
joking. And tell us a little bit about your background and what was your path to these particular careers.
Yeah, so if looking back or when you're in it, that nothing seems like a path. I went to school for I have an MBA in finance. So my first kind of big job was working on the trading desk, the fixed income trading desk at Fidelity, which also nothing to do with skincare. But it was a grind. It wasn't for me. And so I mean it was a good time, a good learning experience, but I just knew that I wanted to do something uh entrepreneurial and working for a big firm it's not, so I'd always had a lot of problems with my skin, a lot of allergies. So I formulated these products to be for very sensitive skin. It was at the beginning of the natural skincare boom, so we sort of rode that wave, which is always better than being too early. So we were right on time, and it really worked. Our first big customer was Costco, and then we expanded that to Costco, all the international Costco's, and Walmart, Rite Aid, Singapore Airlines. We were available on the plane in the duty free. So I got a lot of interesting retail experience, and so yeah, and then then straight into the lice game.
Into the lice game. Well, again, only because I read your bio, it's your fault, and you'll find out what my priorities are. Tell me a little bit about your rescue dog.
Oh, she's amazing. Her name is Raven. We adopted her 5 years ago, so pre-pandemic. She's brown. That's we don't like money, so we waste it on doggy DNA tests. So she's a combo of Australian cattle dog and German Shepherd, and she's amazing. And she usually sits in my office with me. I kicked her out today in case she started barking, but she has a little spot here.
Well, that's not nice, but if you know the Flintstones, she might throw you out.
That's right. Yeah, so she likes to go to the beach, she likes to go to the woods, so she's the star
Nice,
around here.
nice. You'll have to get a new tick product for her.
Yeah, she is always covered in ticks, especially now.
I bet she's a hairy dog, isn't she?
Yeah, yeah.
So back to the lice product, so I won't be too inappropriate with you. Uh, Line extension in the next few years, where does the product line go?
Sure. So again, not a direct path, but it's the same technology, same platform. We covered in our patent application is used for bed bugs and for migraines, and I'll explain each. So for bed bugs, it would be more like something you would put your suitcase in after traveling, because bed bugs can hide anywhere in your house. So treating the whole house, that's not really possible for us at this moment. But if you go somewhere, even fancy hotels in Paris and New York, they have a bed bug problem. So this would be like you put your suitcase in it, that you've taken care of anything that traveled home with you. And then for migraines, we're going to need to do a lot more research. There's some preliminary research out there, that shows that topically applied CO2 improves migraine symptoms and cold temperatures. So we think maybe combining those two modalities would get even more improvement. So this would be patients with migraine with aura. So it's coming. You would have the device in your home, put it on, and you'll be able to cool your scalp and hopefully stop a migraine in its tracks.
Oh, that's so interesting. We've been speaking with Joanna Shu, co-founder and CEO of FreezeNit. Joanna, if someone's interested in learning more about your products, the business, and you, how would they find you?
Sure, you can find me on LinkedIn. I'm always posting about wherever I'm pitching next. Also, our website, FreezeNit, www.freezenit.com. And yeah.
It. I want to thank you for being on the show today. Hope you return again with more stories and progress with FreezeNet. This is Radio Entrepreneurs.